everyone. We thank you for being here. We are delighted to share with our communities. Welcome to the BC Healthy Communities 2024 PlanH Grant Information Center and session today. I am Dr. Connie Allsopp, PlanH Delivery Lead with the BC Healthy Communities Society. My role is to provide supports, resources, and engagement opportunities for PlanH communities. I am here today with my colleague, Stacy Chappel, our Grants and Engagement Coordinator. This morning, we are pleased to share details of the PlanH grants available for local and Indigenous governments. We will do our best to answer questions about the 2024 grant application process. And we are also getting a sense of what communities are looking for and how they might be applying to the grants this year. We'll do a land acknowledgement once more people get on. We look forward to sharing with you a bit more about the grants. And if you could add your name and the land acknowledgement for your community, that would be great. Good morning and welcome. Welcome and thank you for being here today. We'd like to do the land acknowledgement. And thank you for being here. So this is our information session webinar. Welcome to the BC Healthy Communities Grant Information Webinar. I am Dr. Connie Allsopp, PlanH Delivery Lead. My role is to provide supports, resources, and engagement opportunities for communities. I'm here with the team in the background helping out, Stacy Chappel, and the ministry and our other team members. And I'll do a land acknowledgement. And if you could continue putting in yours. BC Healthy Communities, here's Connie Allsopp and Stacy Chappel there. We had the photos up, thanks for that. Land acknowledgements. BC Healthy Communities offices are located on the surrounding traditional lands of the Tecumseh and the Lekwungen Nation, where we work, live, age, and learn. Next slide, please. Today's agenda, we expect today's presentation to be about 30 minutes, following which we invite you to stay on for a 15 to 20-minute Q&A session, and we'll take as many questions as we can. If you can put them in the Q&A, that would be great. Just a quick reminder, today's session is being recorded, and it will be up on the website, so you can review and you can look at sharing it with your colleagues, because we're really delighted to get this out to as many people as possible. Registrants will receive the link in their email that they can forward, which will make it easier than checking YouTube, but we encourage you to do that as well. Please post questions in the Q&A function. It makes it easier for us to respond during the formal presentation, and if we run out of time, we certainly will add these to the replay. During today's event, our BC colleagues, Pat, Monica, Gurmeet, Stephanie, Alyssa, are all behind the scenes. They're adding links and resources in the chat function, so stay tuned and look. We are also delighted to have Michael, Justine, Lara, Rachel, and Megan from the ministry to answer any other Q&A from the Ministry of Health. Next slide, please. Just a little bit about BCHC. I wanted to start with some background on BC Healthy Communities and the PlanH grant. Since 2005, BC Healthy Communities Society supported development of healthy, thriving, and resilient communities. We believe that it is possible and necessary to create communities where it is easy for citizens to be healthy and well. We operate at the intersection between planning and public health. Next slide. PlanH, since 2012, BC Healthy Communities has provided 275 PlanH grants with in-kind supports to communities around the province. The PlanH grants are for local and Indigenous government. Specifically, they support local engagement and partnerships across sectors for creating healthier communities. They provide learning opportunities, resources, cutting-edge practices for collaborative local capacity building actions, and recognize that community policy, planning, and decisions affect everyone's health and well-being. We partner with the Ministry of Health, supporting the province's health promotion strategies. And just to mention that we also have Vancouver Coastal Health adding to our funds and supporting additional grants for their region. Next slide, please. What's the Healthy Communities approach? And so one of the things that is key, there's 5 factors that we really encourage you to take into consideration. The Healthy Communities lens at this point is just these key factors that when you're writing your grant, that you weave them in. This approach recognizes the social, economic, and environmental factors key to determining health and well-being. These factors are known as the social determinants of health. We know it takes more than an individual's healthy behaviors, and in fact, it takes a whole community to ensure best health outcomes. More than just healthcare, evidence shows that 60 to 75% of factors influencing our health lie outside the healthcare system. These factors are public transportation, affordable or attainable housing, available recreation opportunities, social networks, and community design that makes it easier for people to live healthy lives. Removing barriers, one of the things PlanH really supports for projects intentionally that are upstream. An upstream approach focuses on preventing poor health outcomes instead of responding to them after they've emerged. It addresses the social and structural determinants of health. Its goal is to decrease barriers and improve supports that allow all people to reach their full potential. Equity comes first, and this is a key point in the grants to really bring many people and many voices to the table. BCHC and PlanH believes that at the heart of Healthy Communities approach is the commitment to equity, ensuring that systematic disadvantages or barriers don't get in the way of community members' aspirations. We will apply an equity lens. We will know when they benefit the policies, programs, and services for everyone. And we also ask who may be excluded and why, whose voices are being heard or not heard in the decisions. Next slide, please. So the equity that we're showing here, the difference between equity and equality, focus on social determinants using upstream intervention, but the design here shows that if we give everyone the same amount, the same bicycle or the same box to ride, they might not reach their goals or the apple on the tree. But if we provide them the steps needed to get there, 1 step, 2 steps, or 3 steps, they'll all be able to reach their aspirations or the apple on the tree. Thank you. Next slide, please. PlanH grants information, and this is we're hearing Stacy in the background. We're turning to her, and thanks so much, Stacy, for taking the details onto what's happening and applying the points for our grants specifically. So over to you, Stacy.
Thanks, Connie. Sorry, I cleared my throat after unmuting. So thanks everyone for coming today. I'm Stacy Chappel, and I am BC Health Communities Grants and Engagement Coordinator. Today, I'm going to review the application process and what you can do to make your application stronger. Over the coming weeks, I hope you also feel free to reach out with any questions that you might have as you're preparing your applications. So some links to the grant webpage are being posted in the chat, and you can also find these at any time on the BC Healthy Communities website. As Connie mentioned, successful PlanH grant communities receive both funding and in-kind supports from BCHC staff. BCHC offers 2 grant streams through PlanH, and each stream focuses on a different aspect of healthy communities. In 2024, our grant streams are community connectedness and healthy public policy. So I'm going to go over the eligibility criteria the application and adjudication process, and some more details about the streams. Then I'll hand it back to Connie to talk about those community supports I mentioned. Next slide. So obviously, the first thing we need to check for everybody when you're writing grants is, are we eligible? And for the PlanH grants, a local government or Indigenous government must be the primary applicant for the grant. So that includes municipal governments, regional districts, First Nations, and Métis Charter communities. You can see the full list on the slide there. And you can also see those who are not eligible to be the primary applicant. For those of you who are from a nonprofit or other community organization and not a local government or Indigenous government, we encourage you to partner with eligible applicants. The local government or Indigenous government must submit the application and play an active part in the project. Next slide. As mentioned, we have 2 grant streams, and they are community connectedness and healthy public policy. So let's talk a little bit about each of those. Community connectedness grants provide up to $5,000 along with the in-kind supports, and they're suitable for projects that foster community building, connections between community members, and address the mental health impact of the pandemic and social isolation. Social connections are a vital aspect of healthy communities. This stream aims to reduce isolation and improve a sense of belonging in our communities. Healthy public policy grants provide up to $15,000 each and include in-kind supports from BCHC staff. Projects in this stream develop or amend policy to improve health and well-being of community members. Eligible projects might include policy analysis, public engagement in the policy process, research, policy implementation, or evaluation. Next slide. We are also looking to see how your HPP application or your project supports the provincial health priorities. There's some changes to those with 6 priorities that are new this year, and our friends Michael Butler, Megan Thumath, Justine Wardle, Laura Miramontes, and I saw Misty Westlick also there, welcoming you to hear from the Ministry of Health, and they'll be taking questions about those priorities during the question and answer period at the end. And also there's some guidance on those 6 priorities and how they fit the PlanH grant program in the FAQ, or frequently asked questions, section of the grants webpage. So thanks to a partnership, in addition, thanks to a partnership with Vancouver Coastal Health Authority, we're going to be awarding additional healthy public policy grants to communities in the Vancouver Coastal Health region. No separate application is required to be considered for that funding. Just tick off Vancouver Coastal Health on your application when asked. As mentioned earlier, each grant comes with the funding and the option for supports from BCHC staff. Next slide. So a little bit about how to apply. The applications are submitted online through a web form, and that web form is accessed on the grants webpage. The deadline to apply is July 4th at 11:59 p.m. Pacific time. We recommend you review the application guide webpage before completing your application. And applications, you're going to be asked to provide a project overview, a budget, and a work plan. So a bit about each of those. The project overview, this will largely be captured in the web form, which includes questions about proposed activities, goals, and outcomes. You'll also be asked how the project will incorporate equity and your plans for evaluating success. We've posted the application questions on our webpage. It's right at the front page of the application web form. And you can also use that to prepare in advance of applying. The Word document, you can cut and paste right from that into the web form, if that makes it easier for you to prepare. And I think Monica's got a link for you in the chat to those documents. We'll be asking you for a high-level budget. This budget should include the total project cost, not just the components funded by PlanH. So you're going to be looking at including other revenue sources and expenses, including in-kind contributions, and should be noted. And we just had a fire alarm. Pat's going to go check if we need to. I think that might be a test, unfortunately. Sorry about that. Don't know if you could hear it. Other revenue sources, including in-kind contributions, should be noted, and only 40% of PlanH funding can be used for capital costs. These would be equipment, furniture, or building costs. For example, take a community interested in the community connectedness stream. Only 2,000 of the 5,000 grant amount could be used for capital costs. We'll also ask for a work plan, and like the budget, this should be a high-level plan and list the major project milestones, as well as those who will be taking the lead for each milestone, and the estimated dates for completion of each milestone. We do have a template for this. It's a single Excel spreadsheet for the budget and work plan, and that's also linked on the front of the grant application form and in the chat. The template includes a sample budget and work plan as well. You'll be prompted to upload the budget work plan when completing the application web form. We encourage you to include supporting documents with your application. This could be letters of support from partners, reports, or surveys demonstrating the need for the project. And again, you're going to be offered a chance to upload those in the web form. We know that internet access can be intermittent in some communities. If using the web form to apply will not work, please do contact us. You can reach us at grants@bchealthycommunities.ca to make alternate arrangements. So next slide. So our goal is to support you to prepare the best possible application. Throughout the application guide webpage, you're going to find tips on how you can strengthen your submission. These all point to features the adjudication team will be considering in selecting successful projects. In our adjudication process, we're looking for some specific things. We want to see projects that use an equity lens. Equity, as Connie showed in her slide with the graphic, defined as leveling out access to opportunities, making sure that we're providing the appropriate supports to include people, and making sure they have access to opportunities, power, and resources. We're looking at whether your project is making a healthy community accessible to everyone, especially those who need it most. Is your project focused on a group that has been underrepresented at events or in policy discussions? Are you considering anti-racism and the calls for truth and reconciliation? Tell us how equity is incorporated into your plan. We're looking to see meaningful partnerships. So are you collaborating with your health authority or other community groups? Are you collaborating across multiple sectors and bringing all the voices in from your community? We found in past that partnerships make projects more sustainable over time. The partnerships do not need to be set up at the time of applying necessarily, but do let us know who you see as being part of the project team and who's already involved. Letters of support are not required for an application, but if you have them, your application will be stronger if you include them. So please do include those. So partnerships are one way to make a project sustainable. If you have other ideas about how to benefit, how the project's benefits can be extended beyond the grant year, please share those ideas in the grant application. We're looking for evaluation. And if you have a plan to evaluate your project, please tell us and describe a bit about what you plan to do in your application. Are you going to be collecting data, handing out surveys? How are you going to be recording information? And the reason we're asking about evaluation is because we know that projects that take the time to evaluate, review, and recalibrate are stronger and more sustainable. Another bonus of including evaluation plans is that when you collect data, that's going to provide material to include in your final report, which will be due October 2025 if you have the funding. So I'll discuss that in a minute. Of course, the 6 priorities we mentioned earlier, those are also going to be something we look at. So make sure you go through that information carefully. And finally, just review the webpage, which has the application guide information, and review it all before finalizing to make sure wherever your project is touching on those key priorities of our program, that you make sure that's clear. If you have questions, you might find some answers in the FAQ section, which is fairly extensive on the grant webpage, but you're also welcome to book a consultation call with us to discuss your project ideas. So my next slide. Key dates. Just a reminder, the application deadline and other key dates to remember. Deadline to submit is July 4th. The application window is open now. We will notify applicants about the result of the adjudication in August. And if your project is selected, the activities that can be funded can start as early as September 1st, 2024, and be completed by September 30th, 2025. As mentioned, there is a requirement to submit a final report, including a financial report, by October 1st, 2025, and 20% of the award amount is held back until the final report is completed. This report is quite similar to the application form and content. We're interested to hear how things went, what has changed because of the project, and what have you learned. So that completes my overview of the grants, and I'm going to pass it back to Connie to talk a bit more about how BCHC can provide supports along with the funding.
Thank you very much, Stacy. I'm glad that you're our superpower in these grants, and anyone that has questions or needs support can call or certainly email Stacy for that, and we will get back to you as a team, helping support everyone to get their applications in. So next slide, please. Do you have a next slide there, Monica? So we're moving into the Q&A. We do have one question coming up from the audience here that we're using for Q&A. And strengthening our communities here. Thanks, Stacy. This is two parts that we're looking for Stacy to grants engagement coordinator, just so anyone that is applying can go to grants@bchealthycommunities.ca, and the phone number is 778-404-0510. So that's Stacy's contact. If you could go back to the slide previous there, strengthening our community's capacities. Just to recap, PlanH has 2 grant streams, and we provide the cash grants and supports for onboarding and in-kind supports. The in-kind supports can be anything, can range from strategic planning with you online, could be helping you design a survey for your community. It could be that we come to your community and work together with you in a presentation. It could be working online. It could be anything from social media to in-kind supports that you have that you need. Just ask and let us know, from resources to engagement opportunities. The 2 grant streams, the first one is the Healthy Public Policy, which is changing policies in your region and district and municipalities. So if you need other communities that have done this, we also have connections with previous communities that we can link you together with. And our staff is there by email, by phone, or online to collaborate with you. So strategic planning, monitoring, and evaluating, sharing resources with you and others, hosting community convening calls for peer-to-peer topics, and sharing what's going on, strategizing some of the challenges, and just really hearing from others across the province that are doing some good work, in kind and online. We also have the guides to provide for you. So if you need email resources, we can send that. Webinars that we are hosting September 24th, a healthy public policy, and regular emails, and check our website for updates as we go on. Next slide, please. So that was our contact information just for Stacy that you heard. Next slide, please. Upcoming news. So as we're getting ready for any other Q&As, questions that are coming in, if you have them, please post them in the chat. We look forward to answering them. Upcoming news, September 25th, there's a PlanH Healthy Public Policy series, and we have a specific one on a path to resilience, how communities can strengthen child and youth mental well-being. And so lots of resources and tools, as well as speakers from our PlanH communities, as well as a specific lead presenter that can share many of the details that she's researched across the province. We also have age-friendly community grants for 2024 that are anticipated soon. So please check back to our website regularly. So over to the next slide, please, Q&A. So we have one, Stacy, over to you. How many grants will be awarded this year?
So we have $250,000 in grants for the PlanH program, funding for that, and that depending on how the grants ended up distributed between community connectedness and HPP grants, will because they're different amounts, will result between 30 and 35 probably grants that are issued across the province.
Thank you. Thank you. And there's another question here from Ken. There's a paragraph in the application guide about Vancouver coastal health. What should be our takeaway from the paragraph, especially when we're not from VCHC? area?
Thanks, Ken. That's a really good question. So the Vancouver Coastal Health funding is in addition to the 250,000 provided directly through the province. So it doesn't impact applicants from other regions. It's additional funding that's available for those in Vancouver Coastal Health because it's directly funded from their health region. So your takeaway is you should apply.
But that means that the grant money that you just mentioned, 250,000 cash grants, we have additional funds above and beyond that for
It's
Vancouver.
beyond that for Vancouver Coastal Health. Yes.
Yeah.
So it doesn't impact
35.
the sum provided for the province by the province for the whole.
So it could be more than 30 to 35 grants then is.
There could be some additional grants in the HPP stream for those within Vancouver Coastal Health. Yeah.
Great. So the key takeaway is apply, and call Stacy for the superpower to make sure your application is received before July 4th. And with all of the bullets that we mentioned so that you have a really strong adjudication opportunity to be awarded the grant. Another question over to you, Michael, this time. We're going to ask for the ministry support here. If you could just tell us a little bit about a little bit more on the new ministry priorities and how they can best be used in the grants here for what you're adding the points there. I think there were 6 priorities.
For sure. Thank you, Connie, and thanks to the BC Health Communities team for delivering this today. My name is Mike Butler. I'll do a quick introduction. I'm the provincial lead of Healthy Communities, and I'm actually going to defer this question to the architects of the new SPHI guiding framework, and that would be Justine Wordle and Laura Miramontes. And I believe it'll be Justine that'll be able to answer this one.
Yes, hi everybody. My name is Justine Wardle. I'm a manager in the Population and Public Health Division at the Ministry. We're currently working on a new provincial strategy for population and public health. And within that strategy, we've identified 6 long-term priorities for the sector. And these really represent sort of broad population and public health topics that we see as being important for the next sort of 8 to 10 years or so. And so those priorities are really broad and cross-cutting and really intersect with many of the topics that we feel are relevant in the healthy public policy space. So those include Best Start in Life, which is a focus on really that early time in life and perinatal and early childhood and school age years, the health impacts of climate change, population mental health and wellness, which we've heard is a really important topic and relevant to many projects, previous projects for the PlanH program. We also have priorities around prevention of non-communicable diseases and injuries. So those are chronic diseases and injuries as well. Communicable disease prevention, and then prevention and reduction of substance harms from substances. So that includes legal and illegal substances such as tobacco, alcohol, and the toxic drug crisis, just to name a few as well. Maybe I'll pass it back to Connie.
Thanks so much, Justine. I really appreciate your being here to answer some of these details. Another question over to Stacy. I'll throw it to you. Thanks for letting us know the number of applicants we're hoping to fund this year. Can you share what an approximate success rate has been in the past years? How many have been successful out of how many?
Yeah, absolutely. It's a greater than 80% success rate. So it's definitely worth it to apply.
80%, that's
better than 80%. Yeah.
Better than 80%. That's fantastic.
Historically. I mean, if this is the best webinar ever and we triple our applications, that won't hold. But typically it's better than 80% for the, past 5 years.
Awesome. Well, and we're really excited for as many possible applicants and to fund as many as we can. So please make sure you send them in. We really look forward to reading them and supporting everyone in the communities to become healthier. Just going to the next one. Does applications for one stream disqualify you from applying for another grant stream?
Okay, so within PlanH, you can submit multiple applications. So you could apply multiple applications to community connectedness or to both community connectedness and to healthy public policy. You're also mentioning other grants that are administered through BCHC. And no, it doesn't disqualify you from applying for any future grant offerings administered by BCHC. We have criteria for each grant program that's provided by our funder, and that's the basis of administration. We don't look to other programs. So you can apply for both.
That's awesome. And we look forward to reading them because all of the grants coming in are amazing. And, you know, you have creative ideas to help your community become healthier. And you just really have different groups of people working to support them. So we are really excited to read them. It's good to communicate within your region and see if others in your municipality are working towards similar, that you can create partnerships which are really supported with this grants, and that makes strengthening your application, as well as all of the points in the application guide that is posted on our website. So not seeing any further questions. I don't know
There
if
is actually one, I think it got accidentally flagged as complete. There's, and it's from, is an individual in a municipal department working with a nonprofit organization an eligible applicant? If so, at what level in our department should the application be in order to qualify, or is that the department's discretion? So application, if you're a staff member in a municipal government, it's absolutely the discretion of the municipal government or whichever form of government you're working with on whether to apply. The application doesn't come from individuals. It comes from a local government or Indigenous government, and then there would be a contact person. So, but if you see an opportunity, I encourage you to talk about that with your supervisor. We don't specify it has to be a specific department, but your employer may have rules. Municipal governments, Indigenous governments, they each have their own rules and protocols about submitting grant proposals. So I would check internally on that question about what their expectations are. And then we would want to see the application coming from the Indigenous government or the local government. I hope that answers. Yeah.
Thank you, Stacy. I'm glad you caught that one. We always like to make sure we catch all of the questions. So thanks for helping me tag team those. I do have one over to Michael and Justine question. Will there be more information on the new priorities and guidelines available on the website or online somewhere?
Terrific. I'm going to be the best middleman I can be here and defer that question again to Justine.
Yeah, sure. Thanks, Michael. Yeah, the strategy is currently in development. We can't say when it would be released at this time. So I'd encourage you to look at the grant guidelines for the priorities that are listed there and some additional details. That would be the first place to go at this time.
So the PlanH grant. Thank you.
Exactly.
Yeah. Another question that's come in here, and I think we're all going to put our heads together to make sure we can respond for this one. I have a question. We talked about equity versus equality with the populations that we serve. I love this. Can you share what about options you have in meeting us, organizations and staff, with the work overload that we face? Specifically, one may not have time to do a well-rounded multi-paged application with things that support letters and details and budgets. What options are available to make it easier to apply? Stacy, over to you.
Well, I think we all feel that, and we definitely are hearing, not only during the application process, but through the year, working with communities about the struggles that are being faced with just the stress on staff and sometimes staff turnover. So we try to make the application itself quite easy. So additional letters, additional documents, reports, that is not a requirement. If you have them, great. Many communities get funded without support letters or additional content. So, and the application form, it can be done in plain language. So we're not looking for, a huge amount of stats. It's short answers to the questions, and the budget is also very high level. We're not looking for you to count out, we're going to spend this much on coffee, we're going to spend this much on muffins at our consultation session, and we want to have fresh. No, just presentation, food, just high level budget, the big items, the top items in your budget planning is all we're needing, and estimates. And as things go, we also do allow communities to revise if need be, to adapt to the circumstances changing. And certainly when any community has faced, we've had a few over the past couple of years facing major struggles with the fires and other issues. And so we've adapted to what could be done. So that's one of my answers. My second answer is, why don't we have a chat? So send me an email and let's arrange to talk. For our reporting, we do offer oral reporting by interview to make it easier, so you're not writing up a big document if that's difficult, or if it's more culturally appropriate to report orally, or if it's more accessible. So please reach out to me and let's talk about what's going on and what the barriers are for your application, and we'll see if we can figure something out, because we want to support you to be successful. So that's our goal, is to get the supports into communities, especially when you're struggling. That's especially when we want to be there for you with these grants. So please do reach out.
And just to recap, we do onboarding calls in September. And if things have changed since your application, or that your application has come in and been successful, and if there's things that need to change after you've applied, we definitely adjust and can support to move forward with things that after you've filled out the application and need to make adjustments. So the most important is that you send in an application and get us started on the work with you, so that we can then help you adjust as you need to go and provide some extra supports there as well. So another question that's come in, Stacy, this is one for you as well, I think.
Yeah.
Is holding 20% back until the report is completed standard practice for organizations with limited capacity and are large volunteer runs? It would be challenging to not have access to the full funds to complete this project.
Yes, thank you for this question. This is really important. And this is something that affects especially smaller communities that are working in partnerships with nonprofits. That happens a lot in regional districts, where remote areas in the district are partnering with a delivery nonprofit on the work. So in that case, just if you are awarded the grant, we would just have a conversation at the beginning to talk about this. And also, the final report can be completed as soon as the first 80% of funds have been spent. So, or they've been set aside, and when you need that last bit to do the last bit, you can file the final report and have the funds released, and there's still some activities that come after. So so that's also a possibility, and that's something that we've done with several communities who were in that bind with the cash flow, that we were funding something specific that wasn't in their general budget due to the nature or limits that they were facing. So that's something we can work with you on, absolutely. But we really want those final reports because that helps us make sure our program continues to be responsive. So yeah, so if you apply and have the funding, that's something to talk about if we have an onboarding call opportunity, and we can make plans for that.
Yeah, I think last year we had, or I was working together, our team divides up and works with different communities after our onboarding call. And one of them was in September or October was their event, and they had it wrapped up in a video back to us by end of October, and their funds were released. So last year was very quick for the youth entrepreneurship one. So that was pretty exciting to see how quickly they had an opportunity. And I think there was a previous year where they did a Community Connect event with a musician, and they sent us lots of photos of their big event. So that was really fun to partake in some of the videos that they were able to share with us. So that's certainly an important part of capturing what's holding on to there as well. Any other questions, people? If you have some that have come in, any other questions in the chat? Stacy, are you seeing any more? I'm looking through the chat. I'm looking through the questions. Have we captured everything? Have we captured everything? Anyone else? No more questions directly. I think we got all 9, and we're delighted to have over 50 participants with us here today. So thank you for joining us, and thank you for staying on and asking lots of great questions. Again, this is being recorded and will be put up onto our YouTube channel, the BCHC channel, and it'll be also emailed out to all of the participants that registered. So thank you for joining us. And just a reminder, next slide, please, that all of our questions go to Stacy Chappel, who our whole team will be looking at the grants at bchealthycommunities.ca, and certainly setting up appointments with you. You can also call Stacy directly, 778-404-0510. And if you need more, set up a Zoom call, and we will certainly have her available in the next few weeks before July 4th to help you complete your application. But again, just get your application started online. We can see those coming in, and we're really delighted then to allocate time to help you and support you for that. So any last word around the table, anyone? Stacy, do you have something you want to share?
Great. Thanks everybody for coming, and thanks to our friends for coming from the Ministry of Health to help with that.
Yes,
It's
thanks.
appreciated.
Thank you.
Oh yeah, and don't forget to answer the survey. The link is in the chat.
Oh,
That helps us
right.
make this more useful to you in future.
Yeah, we can customize.
Always improving.
Yeah, always improving, and looking forward to getting better and better and providing you supports and resources for your projects. And so thank you again for being here today. We look forward to reading all of your applications. And don't forget to hold the date, September 25th, for our webinar on a pathway to resiliency. Thank you again, and we look forward to reading grant applications and supporting your communities in becoming healthier. Thank you so much. Bye now.